memorial to our 28th president. In his spirit of being both a policymaker and a scholar, we endeavor through meetings and publications and a scholarly exchange program to bring the scholarly and policy communities together. The China Environment Forum was actually created, it just occurred to me a little while ago, we were created 10 years ago. It's a momentous anniversary, little did I know. But actually for me, it's even more momentous for me because I've been here 8 years. And anyone who knows China knows that 8 is a very lucky number. So yeah, the China Environment Forum has been putting on meetings, putting out publications focused on energy and environmental issues in China, trying to promote dialogue. And most recently, last fall, we received a grant from USAID. It's a larger project that's under the Western Kentucky University, focused on environmental health issues in China, particularly on coal emissions in Anhui province and karst water challenges in southwest China. And so there are a lot of scientists that are U.S. and Chinese scientists that are working on these issues in China, and my role is to be part of the information dissemination arm, as well as working with the International Institute for Rural Reconstruction, which is a U.S. NGO in China, to help do community outreach and try to get what happens in the laboratories and in the scientific research out more to the public, because a lot of these problems they're trying to solve is meant to help the communities in southwest China and in Anhui province. So it's really exciting for me and my assistant Lyndon to be involved in this project. But what's even better is that I've also been given a larger mandate to hold more meetings focused on environmental health issues and also health issues, which that is a new area for the China Environment Forum. And actually in the fall, we'll be publishing a new issue of the China Environment Series that will focus exclusively, almost exclusively, on environmental health issues. And one of our speakers is even writing one of those papers. Right, Bates?
Right.
So he's like, whoa, put me on the spot there. It's been recorded, so you know you're going to write it now. No, I know he's going to write it. So today we have, today's talk is titled Health and Environmental Challenges in China, whether it's biggest risks or opportunities for collaboration. And those of you that have been attending my meetings probably know that the angle of the China Environment Forum is, of course, focused on how environmental issues have been a very fruitful arena for U.S.-China cooperation. And I think that, as our speakers today will say, the health sector as well is a very vital one for U.S. and China to cooperate, not just to benefit China, but there's a lot of global benefits in controlling some of the health problems. Our first speaker is Debbie Seligson. I'm going to sit down now. Oh, calm down. Just had one cup of tea. We can calm down. Now, she has served in the Foreign Service for 20 years. And actually, what I thought was amazing, for the last 13 out of the past 23 years, she's lived in China. And that was around, what was the first year you were there?
1984.
1994. So
84.
84. Yeah, and so she's, and I was first there in 87, so I know that she, like me, has seen a lot of the pollution problems getting increasingly worse and health problems growing. She's currently a counselor for the Environment, Science, and Technology and Health Office at the U.S. Embassy in Beijing, where she heads a team of 12 people who are focusing on both the bilateral and multilateral cooperation in the EST and H areas. She's first going to be talking about some of the U.S.-China cooperation in these 4 areas, and I think it's going to be a really valuable overview. Because again, our project, we focus a lot on the health, on the environment cooperation, so I'm really excited about this broader overview. And then Erica Elvander. Now, she's worked on international health issues for more than 10 years, and she's currently in the Office of Research on Women's Health at NIH, and just recently kind of migrated from HHS, where she was in the Office of Global Health Affairs, where she concentrated on bilateral and multilateral U.S. health cooperation with a number of key countries in Asia, notably China. Yay, big smile. So she's going to be talking about specifically some of the health trends in China, some of the major health problems, and what are the kinds of cooperation that HHS, NIH, and CDC have been doing. So again, and just so you know, I give these people 20 minutes, and you will have time for Q&A. So they will be sprinting through their presentations, but there's time for more detail. And last, our closing pitcher today is Bates Gill. He's headed at CSIS. He's been the Freeman Chair in China Studies since 2002. And prior to that, he was the inaugural director of the Center for Northeast Asian Policy Studies at the Brookings Institute. He's a specialist in East Asian foreign policy and politics, and he focused a lot, of course, on Northeast Asian political security and social economic issues. And I think I've been fascinated in reading the things over the years that he's done, that particularly moving into the HIV/AIDS area, and then now also on environmental health, which, again, it was kind of a nice karmic convening of my project that got funded and then his own interest going in that direction. So he's going to focus his comments today on HIV/AIDS trends in China, and I think some of both the domestic and international initiatives in that area. And I think this is, I mean, I'm very excited because, again, for years I focused on the environment, and I'm seeing a lot of fascinating kind of parallel developments in the health sector in China. So I'm going to be quiet now and ask Deborah to start us out.
Hi, good morning. I'll start by mentioning our US-China Science and Technology Cooperation Agreement, which is really the framework under which all of our cooperation in environment, science, technology, and health takes place. And that was signed back in 1979 and is really one of the cornerstones of the US-China relationship. I think it's important to emphasize how central scientific cooperation has been to the developing US-China relationship over the last 30-some years. From the beginning, it was seen as an excellent area for cooperation, an excellent place to build a constituency in both countries for a positive relationship, an area where both countries benefit significantly. And what we've seen in the growth in this relationship over the years is it's genuinely driven by perceptions of mutual benefit. That each of our domestic agencies is funding this cooperation because it's in their own plans, it's in their own interest, they're getting good science out of it. And under our Science and Technology Agreement, we have a large number of protocols and annexes. Over the years, over 90 have been signed, but not all of them are active at any time. But they include sort of the central ones between each of the major U.S. government technical agencies and their Chinese counterparts. And that includes both health and environment. The heart and soul of how we manage that agreement is a joint commission meeting held every 2 years, headed on the Chinese side by the Minister of Science and Technology, who's Xu Guanghua right now, and on the U.S. side by the President's Science Advisor, Dr. Marburger. And we just had our last meeting in Beijing in October. It's held every 2 years, and then it alternates with a lower level meeting of the executive secretaries in the in-between year. And it was the largest meeting we've ever had. And I think that's pretty typical of the way things are going between the U.S. and China right now. Almost every meeting we have and every event we have is the largest one we've ever had, and we've done the most we've ever done because the relationship is really growing and expanding very rapidly. But what was key in that is the number of areas in which people want to work closely with the Chinese is growing. And that's especially true on the research side. We have new MOUs with the Ministry of Science and Technology and the Chinese Academy of Sciences from National Institutes of Health, from the EPA, long-term relationships between the Department of Energy and these organizations, obviously the National Science Foundation, and one other new one that I've forgotten. So when I remember, I'll mention it. But what we're seeing is a growing web of relationships, as well as the direct relationships between traditional partners, like all of the HHS groups and their Ministry of Health counterparts. But China is tripling its science budget, and so the opportunities on the research side are growing very, very rapidly. This is not a one-way street. It's really two-way, and I think that's what's been essential there. On the health side, the relationship, again, operates under a protocol under this agreement. And I know Erica's going to go into the relationship in more detail. I want to mention a couple of things I consider special. One is that it's really was one of the earliest relationships that goes back to 1979. One of the earliest projects under it was a CDC project on birth defects prevention, which is still there. And there's been tremendous growth. Since I've been in Beijing the last 5 years, our HHS presence in Beijing has tripled. So I think that reflects the growth in the relationship. The other thing is we have a number of interdepartmental programs on the U.S. side that have many partners on the Chinese side. There's going to be a lot more talk about HIV/AIDS later this morning, but it's important to mention that our program in Beijing is under the Office of the Global AIDS Coordinator umbrella, so it's a one U.S. government program, and the major partners in that are the CDC Global AIDS Program, the U.S. Agency for International Development, and very much on the ground, even though not in the same funding stream, the National Institutes of Health CIPRA program, big research program, which includes a very hefty component of operational research that's very useful for direct projects. What's useful to mention in terms of AIDS cooperation, and we'll move on to avian influenza in a minute, is that these programs by global standards are not large. The amounts of money are much greater in Africa and other places where we're actually running sort of on-the-ground service provision for large numbers of people. What's useful in China, and where this kind of positive partnering is such an advantage, is that what's needed are some useful positive policy interventions, some pilot programs, some sharing of global experience. The Chinese kind of went from 0 to 60 in a very short period of time on HIV/AIDS. In the spring of 2003, we had SARS. It was, as everyone says, and it's a cliche, but it's true, a wake-up call for the Chinese government on how important health issues could be to overall development. And then they looked, what's the next challenge? What should we be focusing on next? And they chose AIDS. And in the fall of 2003, you have one policy after another demonstrating a much greater level of national commitment. But when you move that quickly, you don't have everybody in place who knows what to do next. So it's extremely useful to be geared up, to be able to provide training, study tours, work on policy guidelines, some excellent models out there in the field. I think that's what our program's been able to do. I think that's what a number of the foundations have done. I mean, on the AIDS side, the fact that Ford Foundation was doing this kind of work since the mid-90s was really important, even though these programs are relatively small. It meant there were things to look at. Another place where we're working, and some of these models I think now have the potential to be global, and that's what we'd really like to see in the long term. We've been working with the Chinese very closely on their methadone maintenance program to try to get drug users off injectable drugs, and that is crucial to preventing any Asian-type AIDS epidemic, which is so heavily a drug user-pushed epidemic. What the Chinese are doing can be useful throughout Asia and probably in other parts of the world as well. So we benefit in a larger sense. On avian influenza, obviously emerging infections are an important area that we have put a tremendous amount of focus since SARS. Erica will talk about it more, but I wanted to mention a couple of things that obviously the issue here and in many other areas is that these diseases are zoonotic and they require interagency cooperation between the animal and the human health folks. I think the global experience is that everybody has a little bit of trouble with that. And so we try to work more closely together ourselves and hopefully promote that in China and in other countries where that's a continuous challenge. In addition to the HHS work, which is tremendous, USAID has been focusing specifically on the animal health side and working in China to help build up the FAO, which when this issue emerged had no veterinarians on staff, no real animal health experience. It was more into agricultural economics and that kind of thing. So we've been working with them very closely, and USDA as well, and especially APHIS is looking at putting some TDY officers out there. Our concerns on the animal health side continue to be greater than on the human health side in terms of what often gets termed transparency, but is really, I think, about information flow. It's not clear that people at the central level in China know what's going on at the local level, too. So building up systems is really important. They've done a lot of work on this on the human side in the last 4 years. The animal side is an even greater challenge, and it's one that we will continue to engage on. it was very, very exciting being in Beijing in 2003 and watching this transformation in health focus almost overnight. In the last 2 years, I feel like we've seen in somewhat slower motion the same kind of transformation on the environmental side. I mean, I've been in and out of China since 1984, and for the first almost decade I was there, I don't think anyone ever even mentioned the environment. And actually, I disagree with Jennifer. I don't think it's because it was clean. I think it's because people were actually so poor they didn't have time to think about it. If you go back to the 1960s, certainly in the winter, and pollution was much more seasonal then than it is now. It was actually dirtier in the winter in China's major cities in the 60s than it is today. But it is definitely the case that with growing economic development, the population is becoming much more aware of it. And I guess we should put a plug in for the fact that Jennifer has some really great environmental lawyers talking about this tomorrow. Right here. But what happened about 2 years ago is the Chinese government started to see environmental issues in political and economic terms as well. And the importance of energy efficiency and fuel switching for economic development and for their sort of position in the world. And that's really offered up a lot of opportunities, I think, to engage more deeply. And then in the last year, you have this calculation of a green GDP, attempts to actually be able to rate local government officials on the basis of their environmental performance. You have a growing discussion of the impacts of climate change on China. I think the science here has really moved a lot in the last 5 years. So Chinese scientists, and in particular Dr. Qin Dahe, who's the co-chair of the Intergovernmental Panel on Climate Change Working Group 1, have a lot more information to use to talk about these issues. And so it's starting to be discussed more, but I really think the driver is economics rather than sort of human health or biodiversity protection or a lot of other things that we also want to discuss, and that there are many people in China who value a great deal. From our point of view, there's a huge opportunity to engage with U.S. technical agencies across the board, and I'm afraid to even start mentioning them because I know I will fail to mention some because we have so many U.S. technical agencies that work on environmental issues. I mean, you have EPA and DOE, both of which have very large energy and environment programs that the Chinese look to for technical assistance, for ideas on how you regulate, for modeling, for all kinds of things. But you also have all kinds of other groups that are working on these things, like, for example, the U.S. Geological Survey that does a great deal of work on things as far-ranging as biodiversity, water. The National Science Foundation does a lot of research in this area. We have a new agreement between the U.S. National Park Service and the Chinese Ministry of Construction to sister parks together. The first one is Yosemite and Huangshan. So all kinds of things going on at the very basic level. Much of this operates under this JCM rubric, but we also have a joint commission on environmental cooperation between the EPA and SEPA, the State Environmental Protection Administration of China. And that only started about 2 years ago and is a really important new vehicle to get into more detail on these kinds of issues. Central to what EPA is doing is an air strategy that they developed in 2003, 2004. And EPA's work with the Chinese on air pollution abatement, on the way you would monitor whether it's going to be for a command and control system or whether potentially for cap and trade for sulfur and other pollutants is really important in developing sort of the ideas behind a strong regulatory system. We've just renewed the protocol between the Department of Energy and the Ministry of Science and Technology on energy efficiency and renewable energy. So that gives us opportunities to do more work on sort of both the policy and the project level in these areas. DOE has also developed a new bilateral energy dialogue with the National Development and Reform Commission over the last 2 years. these opportunities give us it's important. One of the things that's useful is to work at the working level, develop new ideas, do capacity building, technical assistance, and then ensure that these are discussed at higher levels so that there's an awareness of these new ideas among the policymakers. And these kinds of structures give us the opportunity to do that, as does the new strategic economic dialogue. And energy and environment is an important working group within the strategic economic dialogue. It's one that the Chinese enthuse to me about all the time. They think it's a really important part of the dialogue. And so we hope we're going to see a lot of, really concrete results out of it. I can tell you that we do more policy papers for that group than for any other. So there's a lot of stuff going on. One of the first things that'll come out of it is a power sector analysis, which is specifically looking at what's the most cost-effective way to do pollution abatement in the power sector in China. Because, doing it right is so important in terms of the economic cost. You want to make it in everybody's economic interest to reduce pollution, or it's a much harder sell, and you can mandate all the things you want at the central level. If local governments are finding it too expensive, it's not going to happen. So we think they're good market-based instruments that make that easier. So we're talking about those. We're also looking at doing more on biodiversity protection, talking about endangered species, talking about forestry protection in particular. And one of the things that we're doing some of that I think there's opportunity to do more is to talk about the connections between all of these, how biodiversity protection is related to soil protection, which is related to protecting your watersheds, which ties into whether you're also going to be able to protect air pollution, et cetera, how air pollution affects your water, that kind of thing, because it's going to be in terms of these basic threats to the resources that people worry about, in particular water, that you can galvanize support within China. And then finally, I wanted to mention that we talk about these things a lot bilaterally. We also work together very closely multilaterally and are talking more and more about cooperation together in third countries. Multilaterally, the Asia-Pacific Partnership on Clean Development and Climate gives a great opportunity not only to pull 6 countries together, but to pull multi-sectorally, that there's a big industry component to it. There are academics involved. There have been a number of reviews in China over the last year on environmental governance, all of which come to the conclusion that the weak link is actually the government business consultation. That SEPA in particular has been great at getting out and talking to NGOs. They talk to academics a lot. They've actually pushed this part. They have interesting public hearings and this kind of thing. But actually talking to industry and engaging your polluters on how to prevent pollution is the part that really needs to be done more, and that's a big part of the APP and quite exciting. We have another dialogue with the Chinese called the Global Issues Forum, which is a bilateral dialogue specifically focused on talking about our shared interests around the world. And that has taken place now 2 years in a row, led on our side by Undersecretary Paula Dobryansky, and on the Chinese side by an assistant foreign minister, been different each time. This most recent one is Cui Tiankai, was the vice minister. And that's been very useful for talking about a wide number of these global issues, not in our own 2 countries, but both of us as global players. And also within the context of this strategic economic dialogue, we're talking about a number of these issues that are of global importance, whether it's the energy side or the environment, timber, wildlife, not just in terms of what's happening in our 2 countries, but what's happening globally. So I think Jennifer is gesturing that I've already exceeded my time.
You're perfect.
Okay, so I will conclude here and happy to answer questions later.
I must strike terror in the hearts of my speakers. One thing you mentioned, just a note before I forget, is that that the EPA's air cooperation with SEPA, and just that the China Environment Forum, we actually won the bid to host the bilateral talks next month, and I'm trying to convince SEPA and EPA to give a public talk. So stay tuned to your email. We might have a little talk specifically on the air cooperation, which has been, I think, the most fruitful with the EPA side.
But more stuff happening on both water and toxics.
Which I want to see too.
That.
Yes. water pollution trading MOUs and such not. Okay, well,
Okay.
moving on.
And I'm stealing Debbie's watch to help guide me. And I, I feel like the middle innings of a baseball game. I know it's too cold for us to actually have baseball, but and
I was at the Yankee game on Saturday. I don't know about you.
I wasn't in New York. But, and also, I am using slides just because it helps me out. I, as usual, bit off more than I can chew, so I have a lot to talk about, and we'll see how far I get through it. As Jennifer said, up until about a month ago, I worked in the Office of Global Health Affairs at HHS, which is, for those who don't know, the Diplomatic and International Policy Office for HHS, which includes CDC, FDA, and NIH. I'm a policy wonk. I'm not a scientist. I'm not a public health professional. So
Full disclosure.
Full disclosure here. But about a month ago, I took a position at the Office of Research on Women's Health. So if you look in the bio, it says NIH, and you're going, huh? No. We actually have real NIHers here, and I may defer to them at some point to answer any questions about some of my slides, because they're the ones I stole them from. So on that, how does this work?
Just point.
Okay.
I have the mouse here.
There, thank you.
Okay.
But I just,
Press the one on the right.
the one on the right. Okay, and I'm left-handed, so there you go. Just to give you some grounding in what we're talking about, China is a huge place. It has 1.3 billion people. It's still predominantly rural, although 63% is down from 10 or 15 years ago. There is an aging issue. There's a sex ratio issue. I just want to give people a grounding in the demographics of what we're talking about when we talk about health conditions in China. Some people say that by 2050, 1 out of every 3 Chinese people is going to be over 60 years of age. There's a huge aging challenge to deal with. And the sex ratio at birth, a normal or natural incident would be 1.05 boys to every girl. This is 1.12. The Chinese government recently came out with an article and said, no, actually it's 118 males per females. So they're dealing with a lot of demographic issues. A colleague in the Ministry of Health told someone at HHS, China gives birth to Canada every day. I just want you to kind of, and for those of you who want to know how many people are in Canada, it's about 32.2 million people. So this is the kind of health challenges that China is facing, and I just wanted to ground you on that. Okay. HHS. As Debbie noted, HHS signed the health protocol under the US-China S&T agreement in 1979. It was a promise built on goodwill, but with genuine desire to support China with personnel, ideas, scientific exchanges, and truly to be a partnership in building the relationship across the Pacific Ocean. There's no funding behind the health protocol. It's simply a rubric for people to exchange ideas and concepts. And for the most part, that's what it early on was. To give you an idea, in 1990, NIH funding was about $5 million. With China, most of that was for extramural scientists, that meaning Chinese scientists coming to NIH and working in the labs and the facilities at NIH, training exchanges. In 2000, that NIH funding was about $14.8 million, and it was more balanced towards actual grants with China supporting NIH research in China. And then and I keep using NIH because the NIH is very good at running numbers on what they have. So what else about it? Some early successes, as Debbie mentioned, a birth defect study that has been going on for almost 20 years. This is a study involving many, many women in the Beijing area with Peking University Medical Center and HHS CDC. We have an assignee there. This is the study that demonstrated to European and American women that folic acid supplementation alone before pregnancy would lower neural tube defects. That research hasn't really gotten out. Unfortunately, that research has been used very well in the Western community, but it hasn't been used all that well in the Chinese community, and that's an ongoing challenge. Another success, China was declared polio-free in the late 80s and early 90s rather, and this was part of HHS funding to UNICEF and other multilateral organizations working with them to increase polio vaccination. Funding has also been for the Human Genome. Chinese research has also contributed to the Human Genome Project. It's been all over the place. What has changed? In 2001, HHS overall funding for the region, we had 3 CDC staff working through mostly multilateral organizations, 14 million NIH funding and 3.5 million funding in CDC. By FY05, HHS overall funding was $50 million and it was grants, contracts, and staff assignments. It was about $32 million from NIH, about $17 million from CDC, and the Office of the Secretary. And included by 2006 an NIH assignee to CIPRA, which is the Comprehensive International Program of Research on AIDS, a global AIDS program, and an HHS health attaché assigned to the embassy in Beijing. HHS has attachés assigned to India, Vietnam, China, South Africa, and Geneva, and we're expanding that, and other people from my office can probably address that. But that tells you how important the relationship with China was. As our footprint grew, as our relationship, which was truly a bilateral relationship and supportive of each other, grew, we realized we needed somebody there to help answer a lot of the questions. By 2007, we're planning on having up to 11 people assigned to China, including a flu coordinator. That's how important this relationship is. Now, Bates, of course, is going to talk about HIV, but what I want to mention with that is that in 2000, I went to China with then Surgeon General Satcher, and we talked to our Chinese counterparts about HIV, and they said, that's really not our problem, go away. But by 2002, the Chinese had begun to change, and that's no doubt probably due to some of Bates' efforts, but they acknowledged their HIV program, and by 2006, they were the 4th largest recipient of Global Fund funding in the world. They had, let's see, where was my number? About $393 million. Now, that's also to tuberculosis and to malaria, but a lot of it is to HIV, and that demonstrates their acknowledgement and willingness to come forward on the world stage and say, yes, we can be a player. They're right now 4th among 10 countries that receive 42% of the Global Fund funds. For those who are interested, Ethiopia is number 1, and they get $783 million. But that's still a significant contribution, and that tells you where they've gone in so little time, and I think that's important. SARS. SARS, as Debbie said, also was a catalyst. Just to remind you, the first case of SARS was probably in November 2002 in a farmer in southern China. We started to hear about it in February. A Guangzhou doctor checked into the Metropole Hotel in Hong Kong and infected 12 people. Carlo Urbani, a WHO infectious disease specialist, started treating one of the patients who went to Vietnam. He contracted the disease and died in Thailand late in March. This really was a catalyst to the globe about what the power of infectious disease in a way that HIV unfortunately was not. Ultimately, as you can see, there were 8,000 cases, 775 deaths, 30 countries, 6 continents, 30 countries including Canada, and 20 to 25 billion economic losses. This was the first time in a long time an infectious disease had really galvanized the global community because they didn't know what it was. It seemed to come on planes, and so-called developed countries were getting it. And what it forced China to do was, China for a long time had issues about letting people in and the Ministry of Health dealing with it, but it forced them in a way to at least acknowledge a transparency and start working with the global community in a way that they hadn't before on health issues. it brought the Ministry of Health some unwanted but also wanted attention and forced them to be a bigger player. There was stigma, there was fear of the unknown. This picture is from I think it's a Newsweek article. I can't remember. Oh, CBS Evening News. Okay, but from Hong Kong. But it really scared people. Business tourism was completely affected. Flights got canceled. A friend of mine was in Tiananmen Square on May 1 that year. He took a picture that I don't have. It was empty. And this had nothing to do with other issues. Another colleague of mine who was Chinese American was sitting at Dulles, and 2 flight attendants were sitting near him and saw that he was Chinese or Asian American and moved because they were afraid of him. There were it was a real galvanizing issue, and spitting went down in Beijing subways, which I don't think is a bad thing, but things like that. But it also made China realize that to be part of the global community, they had to start at least acknowledging transparency and working with the WHO and working with global partners. And look, they might actually get help, they might get recognition, it wouldn't be bad, as it were. So, okay. In my old job, I also spent a lot of time on flu, so I get hung up on flu issues. These are all covers of various magazines that we've all seen about bird flu, and I just want to, it's still out there, it's still the concern. There we go. Right now, there's about 288 known human cases, 170 known deaths. It continues to infect people. Indonesia is the big hot spot. We've heard about recent cases in Egypt. But what avian flu has also done with China is that China again got caught in the crosshairs here. They had it. Right now, China has only had 24 cases that they know that have been reported to the WHO and 15 deaths. The most recent one was last month in a 16-year-old boy in Anhui province who had no apparent exposure to chickens. The Ministry of Health has been very good about reporting and engaging the global community every time they get a case. As Debbie mentioned, cross-ministry cooperation is always a challenge. And the Ministry of Agriculture has been less receptive to sharing, which is why a lot of times in China you'll see human cases reported with no apparent bird exposure, and that's something that continues to be a challenge. Avian flu is an economic issue. SARS was an economic issue, and the Ministry of Health learned that lesson and learned to embrace it. But avian flu is an economic issue on an even more personal level. There's 15 billion poultry in China, and most of them still in rural farms, even though the majority of poultry farming is in larger production factories. There's also smuggling issues. There's all kinds of issues around here. And what I'm trying to point about here is that this is another place where China continues to be in the news and is trying very hard to be a global partner and use avian flu as an opportunity, but they still have internal struggles, not for any one bad reason, but it's concerns around chain of command reporting. Is this really a health issue? Is this an economic issue? And trying to figure out how to respond well and respond to global concerns, but still maintain some internal security around it. Okay. Now I'm going to talk about what really causes death and illness, morbidity and mortality in China. We've talked about tuberculosis, we've talked about HIV, we've talked about SARS, we've talked about avian flu. But if you look at the top 10 leading causes of death in China, most of them, cardiovascular disease, chronic obstructive pulmonary disease, also known as...
Mike, can you pull the mic a little closer?
Oh, I'm sorry. Sorry. Also known as chronic lower pulmonary disease, heart disease, stomach cancer, self-inflicted injuries, except for that one, and tuberculosis. Most of these are lifestyle diseases. And am I doing it again?
Self-inflicted injuries is a lifestyle disease.
Yeah. We can worry about that. We can talk about that one later. My colleagues from the Fogarty International Center are here, and they can answer questions about the Disease Control Priorities Project, where I got this slide from, which is a project between Fogarty, the World Health Organization, the Population Reference Bureau, the National Library of Medicine, and the World Bank to try and assess, to quote them, disease control priorities and produce evidence-based analysis to inform health policy decision making. And Jim Harrington is here. He'll answer the rest of the questions on that one. But the point here is, I told you I'd point you out, is that if you look at this list, here are the real causes of death and DALYs. DALYs, by the way, is a disability-adjusted life year. It can be thought of as one lost year of healthy life, and the burden of disease. It basically measures the gap between current health status and an ideal situation where everyone lives to an old age and doesn't have disease or disability. It's a mathematical modeling figure. It's not a great one, but it at least is something you can use to talk about the impact of health and disease on economics and lifestyle and that sort of thing. So, but if you look at this, high blood pressure, tobacco, alcohol, indoor smoke from solid fuels, that's a pollution environment issue, poor diet, high cholesterol, indoor-outdoor air pollution, physical inactivity, overweight and obesity, and then we come to contaminated injections in healthcare settings. These are, for the most part, very preventive issues. They're, except for tuberculosis, and there's a lot of preventive work that can be done around there. These are not infectious diseases. These are lifestyle issues. China is just like the U.S. We have overweight, we have obesity, we have diabetes, we have cancers. The causes of disease and morbidity and mortality in China are getting to be like those in the U.S. and the rest of the Western world. And these are what they're going to be confronting. And this is what their health system is going to be confronting. I am going to talk about tobacco because it's important. And if you smoke, quit. Tobacco. China is a signatory to the Framework Convention on Tobacco Control, which is the first international treaty on a health issue. But if you look at the numbers, and these are old numbers, these are the best numbers I could get, which is frightening. 60% of adult Chinese men smoked in 1995. That's probably an underestimate. Worse yet, 60% of male physicians smoked, and again, that's probably an underestimate. There's 320 million smokers in China, and they produce 2,563,510 metric tons of tobacco domestically every year. They are the world's largest consumer of tobacco and the world's largest producer of tobacco by any count. It makes Philip Morris look like, you know, the minor leagues. So this is something to think about in terms of when we're talking, I mean, not that I'm not trying to promote Philip Morris, really, but what I'm trying to put here is that even though a lot of HHS and World WHO and global work with China around health has been infectious disease focused, they have internal chronic disease conditions that are causing far more morbidity or mortality. And they are trying to work on them, but it's something that is perhaps needs more attention. How am I doing on time?
Okay.
Oh, good. Okay. Now, another thing that needs attention is the healthcare delivery system. Here are some recent headlines from the New York Times and the BBC. You know, wealth grows, but healthcare withers in China. The high price of illness. Boy's death at China's hospital spurs riot over care and fees. This is an important domestic issue for the Chinese, and it's going to contribute and exacerbate all of these health conditions that I've been talking about. You know, in March 6th of last year, Wen Jiabao even acknowledged some of, especially the rural turmoil about the social safety net in China falling apart. Here's his quote. He basically it said, some deeply seated conflicts that have accumulated over a long time have yet to be fundamentally resolved, and new problems have arisen that cannot be ignored. This is the largest domestic issue for the Chinese government, and they're struggling with it. Now, the next bunch of slides are more about, I'm going to skip them, but they're about where it was. We all have heard about barefoot doctors and that sort of thing. Well, that system it was a preventive care system. It was focused on health education and sanitation and that sort of thing. That pretty much went away in 1978 to a more socialized medicine. No, whoops, wrong one. They developed a rural cooperative medical system. The central government funding dropped from 32 to 15% without a rise in local or provincial funding. They pretty much got rid of that, and it was sort of like a state-funded mandate to the provinces. Go forth and do, but we're not going to give you much money to do it. So right now, only 29% of Chinese have health insurance. The out-of-pocket expenses account for 58% of health care. Half of spending is on drugs, and people are regularly charged for what they're doing. And 80% of the rural population is essentially uninsured. They have the healthcare system, for all intents and purposes, is pretty much non-functioning, especially in rural areas. In urban areas, it's a little better because a lot of it is through employer-based care. But there's still debate going on in the Chinese government about what to do. Here's an example. Here's the urban-rural health comparison. In the rural areas, infant mortality is higher, and it's actually causing riots and anger. People are angry. They don't want to be deprived of health care. They want to, they don't want to go bankrupt because someone is sick. And a lot of times doctors will give unnecessary tests and unnecessary drugs because that's how they get their money. It's not that the system is developed such that everyone is harmed in the process. The doctors can't survive, so they ask for extra procedures, and the patients can't pay for health care. It's unfortunate. Right now, 11 ministries in China are engaged in this effort, trying to figure out what to do. The NDRC had a commission in September, and they were supposed to come out with a report on what these 11 ministries would do to work together. But again, as Debbie referenced, the ministries, even in other countries, are not very good at getting along, and learning to collaborate across stovepipes is difficult. And so the Ministry of Health, the Ministry of Trains, the Ministry of Defense, the Ministry of Finance, the Ministry of Education, all of these components are engaged in healthcare financing or healthcare delivery, and it's very hard for them to let go of their piece. In urban areas, again, they're starting to come up with some ideas, but only 49% of the urban market is insured. China's trying to figure out what to do with foreign insurers, but they're worried about motives of the foreign insurers. They see the U.S. system and they go, that's too expensive. And the U.S. system doesn't cover 34 million people, as they keep pointing out to us. So, they look at the British system, they look at the Canadian system. My colleagues at the Centers for Medicaid Medicare Services have had so many delegations from so many parts of China trying to figure out what to do next. I will give one more example and then I'll be quiet. In the rural areas, they're trying a pilot study of a rural cooperative medical system, and the World Bank did a study of it and basically said, well, it has increased hospital utilization. It's a voluntary system where people can opt in. It's not at the village level, it's at the province level, or the county level, so there's a larger pool. So it tends to attract more well-off rural people. So yes, hospitalization has gone up, but the out-of-pocket expenses haven't gone down, and there's still a lot of unnecessary drugs and procedures. I think I'm going to stop now because I know my time is up, and I know Bates is going to tell you all about HIV, but I'll answer any questions afterwards.
And we will be posting this PowerPoint online, so you can there's a lot of really fascinating detail on it. So, Bates.
Hey.
I won't use the baseball metaphor anymore. So it's always on, so you can't
Okay.
whisper things in these mics.
Right, so be careful what you say then.
But what you say in the mics.
All right. Well, first of all, let me thank Jennifer Turner very much for the opportunity to be here, and thank all of you for coming. It's an especially great honor for me to be on the same panel with Erica and with Debbie, specialists, policy wonks, real experts who I've been fortunate enough to work with over the last several years, and I have to say everything I've been able to learn has been in large measure because of their cooperation, a pretty good example of public-private partnership, you might say, based out of Washington, but trying to make an impact in China. I thank you very much. I'm going to draw much of what I have to say today from an article which is going to appear in the New England Journal of Medicine at the end of this month, which is an attempt to take stock of the current situation regarding HIV/AIDS in China. For those of you who are interested in this sort of topic, I would also strongly recommend that you have a look at the recently published article by Wu Zunyo et al., which appeared in The Lancet about a month ago. Dr. Wu is the director of the Chinese CDC's National Center on HIV/AIDS Prevention and Control. So obviously a very authoritative, if somewhat biased, take on the situation in China. Let me start with a little bit of background. The first case of HIV/AIDS was reported in China in 1989, but it wasn't until 2001 in the summer that the Chinese Minister of Health acknowledged publicly that China had a major HIV/AIDS problem, acknowledging, if I recall correctly at that time, the estimate of about 600,000 persons they believed that were HIV positive in the country. That was a dramatic turnaround in the level of openness. Even to give a top-line figure of that magnitude signaled the beginning of some change in China's approach to its HIV/AIDS challenge. As has been noted already, however, it wasn't really until the spring of 2003, many people believe spurred by the broader health crisis presented by the SARS events, that this really mobilized support within the Chinese government to tackle its many health-related problems. And there was a greater and greater degree, as I'll go into, of both bureaucratic, budgetary, and technical resources being devoted in China to trying to deal with its HIV/AIDS problem. Today, and these are 2005 estimates, which is something of one of the problems we face in trying to get good, accurate data from China, is that they don't report it openly and publicly, or it's not readily accessible on a very frequent basis. So the most widely cited authoritative data we have are drawn from a report issued at the end of 2005 by the Ministry of Health in cooperation with the WHO and the UN AIDS organization. Now, that estimate stated that China has approximately 650,000 persons who are HIV positive. This disease has spread across all 31 of Chinese provinces, municipalities, and autonomous regions. But about 3/4 of those persons HIV positive in China today are believed to be concentrated in just 5 provinces. Guangdong, Guangxi, and Yunnan in the south, Henan province in the central part of China, and Xinjiang, which is in the far northwestern part of China. However, as I say, it is difficult, at least on a readily accessible basis, to get much better data than that. Let me turn then, having laid out a little bit of a background, turn to what I would see as some of the more positive developments that we've seen in just recent years in the country's response to HIV/AIDS. I'll preface all this by saying that when you go to Beijing today, and I was just there last week and was making some inquiries into these issues, When you go to Beijing these days, there's a lot of talk about how the Chinese government has turned a corner. A lot of talk about how the policy is now in place. It's merely a question of policy. It's merely a question of technical implementation on the ground at this point. I have some pretty serious reservations with that kind of approach, and you hear it both from Chinese government officials as well as members of the international community as well, and we'll get into that a little bit later. But all that said as a preference, let's take a look at some of the key positive steps that we need to acknowledge and welcome on China's part, beginning in around 2003. Very significantly at the top, we saw a rapid bureaucratic change of attitude with persons like Hu Jintao and Wen Jiabao meeting directly with persons who are HIV positive. Remarkable public image for the Chinese people to be more tolerant and acknowledge the HIV challenge that they face. In terms of bureaucratic structure, a sort of interagency working group was established, led by a vice premier, Madame Wu Yi, health being a part of her portfolio. But even in 2003, you might recall, she was temporarily put in place as the acting health minister after they sacked the health minister in the wake of the SARS scandal. So in other words, there was a mobilization of high-level political and bureaucratic resources to try and ride herd upon the vast Chinese governmental system to address the HIV/AIDS challenge they faced. But it wasn't just bureaucratic in nature. There were serious policy changes developed by the Chinese government. For example, instituting a national HIV treatment plan. Talk about that a little bit more later. In January 2006, the passage of an important law by the National People's Congress concerning persons who are HIV positive or living with AIDS in an attempt to assure that these persons were not discriminated against, and to lay out some of the governmental organizational responses which would be necessary to deal with the HIV/AIDS problem in China. Also, in this past year, importantly, there's been a very dramatic increase in the number of methadone maintenance therapy clinics and centers that have been established in China. There's been a real ramp-up. According to Chinese official data, by the end of 2006, there were about 320 of these centers across China, serving on average about 200 addicts per day as a way of trying to wean them off of the use of infected, I should say, sharing needles or using heroin through injection. That's up. That number 320 was up from virtually zero just a few years ago, and the government has very ambitious plans to get that number of centers up to about 1,500 by the end of next year, by the end of 2008. Those are some interesting policy developments. Budget increases, also very significant. China devoted the approximate equivalent of about $12.5 million in current exchange rates in 2002 to HIV/AIDS related programs, now nearing $185 million equivalent in renminbi in 2006. So that's quite a major increase. Wouldn't we all wish to have such budgetary increases for our programs? And also importantly, international cooperation has been embraced by the Chinese government and has significantly expanded in just the past several years. I think these are figures from the end of 2005 again, but it gives you just some sense of what we're talking about. International cooperative programs to combat HIV/AIDS are now present in some 27 provinces in China and represent a cumulative total by 2005-06 of about $230 million of foreign support or commitments through about 2005-06. That includes, as already mentioned, approximately $148 million spent or committed by the Global Fund for AIDS, TB, and Malaria. Also, probably the most significant U.S. Private contribution to HIV/AIDS in China was the $30 million announcement by Merck a couple of years ago to implement a program focusing on HIV/AIDS in southern Sichuan province. And there are other very significant public and private commitments. Many persons are also awaiting the announcement, perhaps this month, because he's in China. Bill Gates is in China. There may well be an important announcement of the Gates Foundation moving in a significant way in China as well. So all of this is, very positive news, and we should take it as such and acknowledge that China has made a significant change of attitude, and there's been dramatic efforts to address its problem aggressively in many, many parts of China in just over the past 3 to 5 years. But I think we have to acknowledge at the same time that there are continuing and significant problems in the way that China has taken on this issue, not least, as Debbie has suggested, because of the enormity of the resources pouring in and the very, very rapid effort that China has undertaken in just the last couple of years. That in itself creates and generates some downsides. Let's go through some of them. I have about 6 or 7 issues that I think really, really need to be addressed quite seriously. These are policy issues. These aren't technical implementation issues necessarily, and that's why I think we need to examine this notion that the policy change has been complete. It's just a technical implementation challenge. Number 1, stigma and awareness. Stigma remains a major, major problem in China on the HIV/AIDS front, even to the extent that healthcare workers in China continue, in certain instances, continue to be afraid of or refuse to treat or deal with persons they know to be HIV positive. Maybe this isn't a stigma issue, but it certainly is something related to awareness and the politics surrounding the HIV/AIDS issue. Was this most recent instance of the elderly obstetrician turned HIV activist, Dr. Gao Yaojie from Henan province, who was refused the ability to leave China to accept an international award here in China by local authorities who feared that her presence internationally would reflect poorly, as it should, upon the Henan government's approach to dealing and combating with HIV/AIDS. It's one small example. This sort of stuff happens all the time. Gay activist activities being shut down, NGOs being placed under pressure. There remains a serious problem, especially at local levels, to improve the problem of stigma and raise the awareness and understanding and tolerance related to HIV/AIDS. I noted today that last week, a fellow named Jing Jun, who works at Tsinghua University, there was an important panel in Beijing last week that I was unable to attend, but at that panel, apparently, Jing Jun, who's done a lot of work on HIV/AIDS in China, claimed that in China today, in spite of all the efforts of the Chinese government and the international community, that in China today, he estimates 2/3 of the population still does not know about HIV/AIDS, what causes it, or how one protects themselves from getting infected. That's a major, major problem. That's a policy problem. That's not a technical fix that we can think about easily. Secondly, the unidentified persons who are HIV positive in China today. Even after massive testing in 2004-05, especially in central provinces in China as well as in some of the detention centers and prisons, still, if we take the 650,000 HIV positive person estimate in China to be accurate, there have only been about 184,000 persons who have been positively identified as being HIV positive in China as of the end of 2006. So what we're talking about is between 60 and 70% of the people thought to be or estimated to be HIV positive in China probably don't know it. And the Chinese government does not know precisely where they are. if you believe, as I do, that there are a lot more than 650,000 persons HIV positive in China today, then that percentage of unidentified persons becomes even greater. This is maybe a little bit more of a technical issue of trying to spread out the testing capacity of the country. A third issue or challenge we need to think about is that the disease seems to be moving into what you might call the mainstream population. In the past, and still today, I guess, the epidemic is largely understood to be what some people call, an Asian-style epidemic. That is, that it's largely fueled through shared needles and injections in the injecting drug use community. However, there's been some interesting changes to some of that, and I think we need to keep our eyes on it. For example, in the year 2005, among those persons who were newly infected with HIV in that year, the Chinese government estimates that about 49.8% of them became infected by sexual transmission, whereas 48.6% were through the use of sharing of needles. Why is that significant? That's the first time that we're aware of that the proportion of persons contracting the disease through sexual transmission was larger than the proportion of those persons contracting the disease through shared needles. I suspect that trend is going to continue as it becomes increasingly, steadily, but increasingly a problem of sexual transmission in China, rather than by IDUs. The injecting drug use problem will remain significant, but I suspect the sexual transmission aspect will increase. And anyone who's been to China in any recent years can understand that. There's a sexual revolution going on in China with premarital and extramarital sex on the rise. You can't go anywhere in any of the major cities in China without seeing prostitution and sex work clearly and obviously evident on the streets. Another interesting phenomenon is the increase in the tolerance and openness of men having sex with men, homosexuality, which has its own unique aspects for the potential spread of this disease. So I think we can increasingly see that the disease is going to be moving into a more mainstream part of society, not necessarily concentrated with so-called marginalized groups like injecting drug users or commercial sex workers. Something to follow, something to watch. Another issue to raise concerns the methadone maintenance treatment clinics, which I talked about earlier. While it is, I think, a welcome development that these have been rapidly increased and expanded, and that growing numbers of injecting drug users now have access to methadone maintenance therapy, that's all good news. But in the rush to meet their targets, meet their quotas for the establishment of these methadone maintenance treatment centers across China, we are learning that some of them are just basically pharmaceutical dispensaries. If that, they aren't really set up or arranged in any way to try and test persons who come in to receive methadone replacement, methadone maintenance therapy. There are not the facilities to offer counseling and other comprehensive services in trying to reach this significant population in China that is at such high risk of HIV infection. So I think that's another issue that needs to be addressed. Turning to more technically oriented questions, there too, I think we still have issues. I think many people question the capacity of the Chinese surveillance and monitoring system in China today. Testing remains a problem. Here's a policy issue to think about. Some years ago, testing for sexually transmitted diseases of persons who were preparing to be married was dropped across much of China. Today, some localities are talking about reinstituting that policy. Clearly, that would be a relatively easy way to try and assure that a broader surveillance or a broader testing program is reaching out into mainstream parts of society. Treatment. HIV treatment is another big technical and policy issue in China today. I don't want to get into details, but just to say that many aspects of the treatment program are poorly implemented, and there is the very, very serious and already ongoing risk in China that drug-resistant HIV is becoming a bigger and bigger problem as a result of the poor treatment program that has been implemented quite quickly over the last several years. Two more issues. Non-governmental organizations, something near and dear, I'm sure, to everyone here in this gathering. They remain under some questionable circumstance in China in their ability, both as domestic NGOs or international NGOs, to do more to help the government address the challenges they face on HIV/AIDS. The Global Fund for AIDS, TB, and Malaria, in its 6th round, which was decided upon last year, hopes to begin implementing in China this year a $14 million program over the next 5 years to help build capacity of the Chinese non-governmental organization sector to address HIV/AIDS. But there are very, very big questions about whether they'll have the capacity to absorb this kind of money, just how independent they really are, etc. And whether, in a more strategic sense, the Chinese government is truly prepared to accept the role of non-governmental organizations in contributing to combating this disease and others in China. And then finally, and here I hope we can engage a discussion of the many representatives of the U.S. government here today, it's my understanding that some of our important programs on HIV/AIDS in China are going to be cut back and closed down completely. Most importantly, the NIH CIPRA program, which is engaged in on-the-ground research and operational research due to forthcoming funding cutbacks that the entire U.S. government has to face up to. This very, very important program is going to be shut down in the next couple of years, if not this year. But I'd be interested. I've heard this. I'm not fully up on the details of this, but obviously this raises some concerns that successful and useful programs between our two governments are facing the prospect of being shut down in the near term. But overall, I guess I would say we have a glass half full. We ought to be relatively positive about the important changes ongoing in China, but we do need to make sure that we're keeping our eye on these outstanding challenges that China still faces. Thank you.
Applause for these three folks first. And I think that Debbie wanted to make a comment related to the last question that you posed.
Actually, to a couple, because let me go into our U.S. government's strategy for focusing on HIV/AIDS in China is two-pronged. The first half is called Prevention with the Positives, which is all about helping improve the testing and informing system in China and providing quality prevention services, as well as ultimately, when people need it, access to care through what we call a continuum of care approach. And so we're working very actively with the Chinese, and we've certainly seen a great deal of attention, not only at the national CDC, but in some of the provincial CDCs where the disease is most prevalent, to the need to improve the testing and informing part. I would like to see more focus on the counseling part of that. I think that's a part where the Chinese struggle. Counseling is not a particular long-standing tradition. So there's definitely more that needs to be done, but it is a big focus. The other big focus of our work is focusing on what are called most at-risk populations, and those are basically drug users, men who have sex with men, and commercial sex workers. And the reason you do this is because even though sexual transmission is increasing, what the epidemiologists tell me is probably half, approximately, of those who contracted HIV through sexual transmission did it directly through sex with someone who used drugs. So if you run the models, and the person who's the best at doing this is Tim Brown at the East-West Center, what you see is that drug use drives the epidemic for a long, long time, even though after it becomes quite prevalent. And if you can cut the drug use, which is the whole part of the methadone maintenance, you can really take the steam out of the epidemic. You also need to have interventions with other groups that are at high risk. Men who have sex with men, commercial sex workers are the big ones. A lot of talk about how you focus specifically on those commercial sex workers who are also taking drugs, because that's a big sort of bridging population. What we found is the most effective programs, and we've done this, DFID from the UK has done this, are these peer educator type approaches, where you have drop-in centers, you engage peer educators, you get them out into the community. Just last month when I was down in Yunnan province said they've decided to try to fund 1,000 peer educators themselves. So this kind of approach is growing. We're seeing the provincial governments look to do things in a more innovative way. One of the things is to ensure, for example, as they do drop-in centers, that they don't wind up in office buildings where people can't access them, to talk about what all the specifics are that makes them successful rather than non-successful, and that's sort of an ongoing iteration. On the money, our budget is actually increasing. We got an increase for the one USG program, the CDC USAID program this year. Ambassador Tobias, who was the Global AIDS Coordinator and it now heads the whole international development program, was very impressed by what he saw when he came to China 2 years ago and has expressed a lot of support. And one of the things he was specifically interested in is how can we develop these models in China that we can then use elsewhere. And I think that's one of the big interests, and we're starting to talk with our Chinese counterparts about looking for how you develop these to move onward. I can let Jim or Erica talk more about CIPRA, but CIPRA was a 5-year grant, and the whole idea behind CIPRA was to develop capacity so that the people who use that grant would be able to apply for other kinds of grants in the future. And I believe that the principal investigator for CIPRA is in the process of applying for a number of different kinds of grants. I don't expect that we'll see a reduction in his team's research output in the future. I think we'll see an increase, and that he will continue to grow and have partners, and that the work around China on AIDS is being funded by many other parts of NIH and by many other international research organizations. It's also quite clear that health research is an area where the Chinese government is putting a lot more money, so we're also going to see a lot more domestic money in China for research on everything, including HIV/AIDS.
Okay. I'll hold my question for a minute, see what's out there intellectually for my speakers here. So Justin and Julie are going to have microphones, so if you'd raise your hand and you need to use a mic because we are webcasting. And when you get the mic, if you could just say your name and affiliation so we know where you're coming from. So any questions or comments out there? Justin, can you grab the mic over there? Thank you. Okay, Bob. Yeah.
Oh, excuse me. From Cornell Alumni Club, actually. But I'm an alumnus of the Foreign Service also. In all of this, the cross-cultural and cross-functional communications run through the American Embassy in Beijing and the U.S. government agencies. It's quite a network. What is the role in any of this of the science section of the People's Republic of China Embassy in Washington? Do these agencies around the table work with that embassy? It presumably represents China's interests in all of this. That's my question.
Good question, Bob.
I'll take the first stab and let other people respond. But certainly, the Chinese embassy here in Washington is equally engaged in representing their government's interests in health and science research with the U.S. government, and have a science person assigned to the health portfolio, but also as well as other parts of the science portfolio. And all of us here in the U.S. government who have done science work in Washington have certainly interacted with the Chinese embassy on numbers of occasions. They also, and I'll let Debbie address how they interact with the U.S. Department of State on that issue, but
Well, the Chinese government staffs its science sections from a number of government agencies within China. The Ministry of Science and Technology is the largest, but they actually have attachés from other science agencies as well, and they're very much tasked with going out and looking for cooperation opportunities on the ground for their individual agencies. And so, for example, there's usually, in places like Washington and in Paris, they'll have one from the China National Nuclear Safety Administration as well as from Ministry of Science and Technology, and they work very closely with the Nuclear Regulatory Commission here to improve cooperation on nuclear safety, which the Chinese are looking to do a lot of capacity building as they do this major push to build more commercial nuclear reactors. I want to tell a really nice story from during SARS. All of the Chinese science counselors and attachés around the world were asked to go out and look for any scientific research that might help the Chinese government as they tried to combat SARS. And so the health attaché in New York happened to go listen to a lecture by a professor at the Columbia School of Public Health named Dr. Ian Lipkin, and afterwards the health attaché said, this could be really helpful to China. He was talking about how one of the models in his research might be useful in some way. And apparently this guy then went and visited Professor Lipkin a number of times, convinced him to go to China. He traveled to China in the middle of SARS, met with the Minister of Science and Technology as well as a number of other people. He now has a new cooperative research program with Beijing University, all of which was inspired by this health attaché thinking, this is a guy who's doing something really interesting that we could really want to work with. So at least in some cases, they're really out there on the ground looking for good stuff that can do things, but they definitely do meet regularly with all of our technical agencies here in Washington, and the cooperation goes multiple parts. The science counselor here in Washington now was the former Deputy Director General in the Department of Foreign Affairs in the Ministry of Science and Technology, so we knew him well in Beijing. And they tend to switch back and forth.
The name?
Jinju.
Yeah, and one other point, as I mentioned earlier, we have an attaché in Geneva that's primarily to interact with the World Health Organization, and China, being having the DG of the World Health Organization right now, another demonstration of their growth in the public sphere around health, and also being very engaged in the World Health Organization in general, has a strong presence as well. And so I know that their health counselor in Geneva is constantly talking to David, and vice versa. David Homan is our health attaché in Geneva. And so it's a very bilateral relationship around a multilateral organization. The last thing I want to say is that the science section at the Chinese embassy here does produce a monthly briefer to anyone who wants it about China's science successes. And I know I get it, I know my colleagues at NIH get it, I know Bates gets it. It's a summary of what they're doing because science R&D is so very important to the Chinese government right now.
Yeah, and if anyone wants, you can just email me. I'll hook you up with Wang Yan there, who does it. Francis, did you have a question? Yeah, Julie, right here, the gray suit. Thank you.
Francis Lee from the National Science Foundation. To answer Bob's question further, at NSF we get dozens of visitors a year from China wanting to talk to our various disciplinary directorates about opportunities for cooperation and programs that NSF is supporting, maybe projects that we're supporting that are relevant to China, and so on and so forth. And many of these visitors are mediated through the science section of the Chinese embassy here. The mirror image is that, as you may know, NSF has a Beijing office, and I'll give you an example of the kind of work that the Beijing office does that relates to this topic. NSF supports basic research, which it's often hard to see what the connection is with a particular problem. But one request that we are funding right now is for a postdoc student to go to Qinghai Lake and put radio collars on some of the wild geese out there. This is a biology project, and it's to look at, it's probably environmental biology, but obviously it's very important for predicting how bird flu or other zoonotic diseases can spread, to know what happens to these birds when they leave Qinghai Lake, which, by the way, was a big source of a big repository of avian flu last season. So our Beijing office people helped to get the permits to get these radio transmitters into the country. Without that intervention, it might not be allowed. So it's all one big circle, and it helps to have cooperative relations on both sides.
Just to clarify what Francis was talking about, there was an outbreak of bird flu in Qinghai Lake that became an international concern because of reluctance by some Chinese government officials to let Western observers go and see what was going on. And this happened in either 2004 or 2005. The years are beginning to blend into one for avian flu people right now. But it certainly forced the Chinese onto the stage around avian flu again in a way that they hadn't before. So that's an important point.
Some other questions or comments out there? Yep, right here. Justin's right behind you with the mic. Good.
Hi, my name is Brent Christensen. I'm currently serving in Senator Olympia Snow's office on the Hill. Debbie, I wanted to ask you to perhaps expand a little bit on how you mentioned this is sort of a two-way street on the scientific cooperation. On the face of it, it sort of looks more like a one-way street, given that China's hunger for technology and technical expertise. What do the Chinese offer that is a benefit to the U.S.?
Well, I think everyone who's doing joint research in China is there because there's something there they want to do that they can't do in the United States, or that they find is better. Obviously, one of the reasons that health is a big area for this is because often you need to go where the diseases are. So you need to be global. But there also are areas of excellence and niches where the Chinese are doing really excellent work. And I think many, many people have found good collaborators for doing very specific things. And these are just going to increase over time. Francis may want to talk more about this, but one of the reasons National Science Foundation opened its office in China is because they're trying to make sure that U.S. science is global and ensuring that American scientists get out of the U.S. more to have relationships around the world, so that as important scientific discoveries happen elsewhere, that they have those connections and the shared learning. That part of maintaining our own excellence in China is ensuring that our scientists are connected with people who are doing excellent things everywhere in the world. As the Chinese go through this tripling of research money, the amount of good research that can happen in China and the opportunities for collaborating on things where the Chinese are spending a significant amount of money just go up. I mean, we already have significant research projects where we co-fund, and I think those will continue to increase so that the investment part of what they're doing increases. I think one of our interests at this point is in, working with the Chinese to see that this money is spent as effectively as possible, because there is a finite amount of research money in the world, and it's to all of our collective benefit if it's spent in ways that cause real results. And I think that's one of the reasons why the National Science Foundation has collaborated so closely with the National Natural Science Foundation of China, and work not just on individual projects, but on how you run an effective peer review system. It's one of the reasons why we do things like ethics training, which NIH has done quite a bit of over the years, to try to help, as this becomes a major research powerhouse, help make it one of really excellent standards. There's a lot that's going on in China itself, but it's one of the areas where I think we have a lot we can offer. But nobody, I mean, the Chinese obviously want to learn as much as they can. They obviously want specific technologies or whatever, but nobody who's going there to do research is going there on any other reason than they see it in their individual advantage to do so.
90% of NIH's research funds are extramural. That means they go to UCLA and Harvard and Columbia, and they are peer-reviewed grants that are reviewed from that perspective, and not because they're China or India or Brazil or Denver. So NIH is, I'll let Jim Harrington, who's the Director of International Cooperation Relations, or I can never remember your title. Anyway, from Fogarty over here can answer this one more closely. But NIH's research funds in China have grown because there's been interest in research in China. Now, at the beginning, in 1990, most of those researchers were training grants contributing effectively to the brain drain of China in 1990, but that has changed dramatically. And it's gone from $5 million a year to about, what did I say, $34 million or something like that in FY04. So, and that is researcher driven. I don't know if Jim wants to address that at all.
Please.
Thank you. I'll be glad to comment. Jim Harrington I'm the Director of the Division of International Relations at the Fogarty International Center at NIH. And clearly China offers the U.S. Many things, but to put it rather bluntly, as Dr. Zahuni, the Director of the NIH, says, if you aren't at the table with China or other major players around the world, you'll be on the menu. So you better cooperate and work with, I mean, that's sort of tongue-in-cheek, but I think there's seriousness in it as well, in that if we're not competitive and developing relationships with researchers in China, then we won't be competitive. There are probably, on any given day, about 500 Chinese researchers in the intramural program at NIH. That's the in-house labs up in Bethesda and elsewhere around the country. They arrive there because they're very competitive. It's a competitive program. They make applications to the lab chiefs, and they're selected. So there are probably about 500 on any given day. Those relationships are built with the lab chiefs, with those Chinese researchers when they return back home to China. That is a benefit to the U.S., to know those people, to know what they're doing, and to work with them on collaborative efforts that will help both China and the U.S. So it's very much a collaborative, cooperative relationship we have with the Chinese. And I think that's the mutual benefit you mentioned earlier that is important to all of us. And I can speak more about that, but I think that's the important point I wanted to make.
I'd like to just quickly interject something, because we're talking a lot about the research type of cooperation, and Bates talked a lot about these international program on HIV/AIDS. And I wanted to ask, maybe each of you can say something briefly. What are all these international projects and funds, what are they really doing to help address what Erica talked about, the huge healthcare system problems? Is there no connection? I mean, like in HIV/AIDS, there's a lot of this is working in rural areas. Is there going to be any positive spillover to kind of help address some of the healthcare problems in rural areas, Bates, or is this just solely focused on HIV/AIDS and no spillover?
I think it's still relatively early to base a very good judgment in answering that. I mean, this is still, a phenomenon that we've seen really in just the past several years, especially on the HIV/AIDS piece. My initial instinct, and this is really just based on what I think I know about China more broadly, is that especially in rural areas, there is an enormous reliance and dependency upon these foreign funds, and that the whole notion of capacity building and weaning clinics, hospitals, doctors, etc., off of foreign funding and into a situation where they can be sustained through their own ingenuity, entrepreneurialism, or through Chinese government funding, I think is weak right now, and likely to be so for the foreseeable future. HIV is can often be such a unique and narrowly defined disease. Probably, in some sense, the amount of money that's been poured into China in HIV/AIDS is not commensurate, or in other words, it's probably greater in many respects than the other major health issues that confront China, which Eric showed to us. And so maybe in that sense it is diverting some resources away from broader and deeper problems that are structural and systemic related to the Chinese healthcare system, especially in rural areas.
Okay. Erica and Debbie have anything to add to that?
I would like to think, I'll notice how I couch that. I would like to think that some of our work, less so through the research portfolio and more so through the Centers of Disease Control and Prevention activities based in China, while the CDC does surveillance, does epidemiology, does field epidemiology training, does global disease detection, they are working with the Chinese to develop this kind of emerging infectious disease training program. They've had a field epidemiology training program, which, for those who don't know what that means, that is a way of taking the epidemiological intelligence service based in Atlanta and turning it into training in real situations in country. It's a 2-year training program for epidemiologists in China, based in China, to use the real life setting there. Now that is a public health, that is a surveillance, that is an epidemiology structure building tool. And the number of people who graduate from that program is 20 or 30 a year, I forget. That is a small amount, and that is an infrastructure that is not helping the healthcare delivery system per se, but is helping the local and provincial CDCs and health departments develop at least disease tracking mechanisms. And I will tell you that during the SARS epidemic, the most productive people in the provinces and in the localities who were able to contribute to data collection and tracking cases were those who were trainees from FETP, the Field Epidemiology Training Program. So in that regard, and I didn't really touch on that, we are contributing to the public health infrastructure. And my hope is that in other programs that we are supporting that are less well known or less touted, that kind of indirect interaction between the public health infrastructure building and other infrastructure capacity building activities, be them through HIV or pandemic flu or lab capacity building with pandemic flu or other diseases, will rub off and extend to the infrastructure in general. I am a realist. I grew up in Washington, so I am hopeful that is the case. I cannot say for sure that is the case.
Okay. The problem that you raised, Jennifer, I think has been a problem sort of globally, and that when you have these mono-disease-focused assistance programs, it can actually threaten the overall healthcare system. I think in China that I think it's without question that it has not made it worse, and in some ways has created the environment where it can get better. As Hank Beckenham, the WHO res rep, likes to say in Beijing all the time, healthcare wasn't even on the agenda before SARS. So until that happened, the Chinese government wasn't looking at these profound problems with healthcare delivery. And so now, as the central government has focused more specifically on healthcare delivery, it has really made a difference in terms of them thinking about these issues. It is the case that most international assistance is focused on infectious disease. It is infectious disease that moves borders in obvious ways. I mean, the truth is, as we look at sort of the globalization of diseases like heart disease and diabetes, they seem to move across borders too, even if it's not a microbe that's causing the movement. And I think we have a lot that we need to figure out how to share and learn from each other on all of the diseases that are the largest killers of the Chinese people and the American people. But what I would say is, first of all, healthcare spending in China is 6% of GDP. What is the issue, as Erica said, I think, much earlier, is that almost all of that comes from people's individual pockets. It's actually one of the lowest government expenditures in the world. So the percentage that's actually spent by international donors is a tiny, tiny fraction of money. It's focused on some very specific diseases. It's made a difference on HIV. The work that we do with the China CDC, I would say, is comprehensive infrastructure development on the public health side. It's not that disease specific. And then there have been some other really, really important interventions on diseases. The most important is the work on TB, funded by the World Bank, by DFID from the UK, and with a lot of technical assistance from the WHO, and actually some very targeted assistance that WHO asked us for from USAID as well on actually getting on supply chain management, getting the drugs out to areas. And China has doubled its rate of detection of highly infectious disease and its rate of treatment, of effective treatment of highly infectious disease in the last 3 years. So these kind of targeted programs can work, and when they do work, that one I would say is probably massively increasing the access of rural people and urban migrants to health care, because TB is one of their major, major issues. It's a much larger issue than HIV. But today you do have this situation where everybody is talking about what to do about healthcare financing in China, how to get healthcare delivery out to rural people. The current rural cooperative healthcare system has a lot of challenges to it, but the Ministry of Health has recognized that. They've asked for 6 different groups to write papers on what the next step should be. Half of those are domestic, half of those are international groups. So they're actively looking for new ideas. Making a change is going to be expensive, and I think it's going to be a long process.
Okay, I've got some people. One has the mic, so he's got it. 1, 2, and then 3, Beverly. Okay.
Good morning. Thank you to all speakers for an excellent briefing. My name is Ed Maybeck. I'm a professor of public health at George Washington University. And my area of focus is communication and social marketing. I have to say that perhaps this reflects more the law of the hammer than anything else. But virtually every issue you've all touched upon this morning strikes me as having a major communication challenge inherent in it, a major social marketing challenge, and ultimately, at its root, a major behavior change challenge. So that was something of an observation. My question is actually for you, Bates. You said something this morning that I'd never quite heard before, articulated in that manner, and I'd love to hear you say more about it. You said that low awareness is a policy problem rather than a technical implementation problem. From where I sit, it often looks like a technical implementation problem. So I'd really like to hear you speak a little bit more about that issue.
Thank you.
Well, just to maybe go back to the Gaoyaojie example. One of the reasons behind the Henan authorities' reluctance to have one of their citizens gain greater prominence on the international stage is that as government authorities, they are fearful that their own shortcomings and lack of policy implementation of central mandates is going to come back to bite them and become a problem for them professionally. More deeply, it's still the case that there are probably a range of government officials active today in Henan province, and even those who have been promoted beyond Henan province and are serving at the central level, who were aware of and complicit in the blood scandals of the mid-1990s in Henan and other central Chinese provinces that led to the dramatic increase in HIV, the HIV epidemic. In other words, these individuals, especially in some of the rural areas, simply do not wish to implement or policy, nor to allow for some greater awareness to expose their provinces to the truth of the problems that they face. Now, I guess we could quibble about whether that's a technical problem or whether it's a policy problem, but I think it has something to do with attitude and behavior, as you say, and it also has to do with an ability of the central government, to translate what are very positive and welcome policy initiatives at lower levels. And that's not just a technical issue. That's not just a question of throwing money at it. It's a question of changing attitudes. It's a question of center-local relationships. It gets into things that I think go well beyond mere technical fixes.
Okay.
Can I add
Yeah,
something?
sure.
I guess that in part, I'm going to agree and disagree with Bates. I think that it's a policy issue because there needs to be a policy to address some of the technical problems that you're alluding to. I mean, it's actually always stunning to me the percentage of Chinese who know the 3 modes of transmission for HIV/AIDS. And I would put money on it that most Americans don't. And they don't need to. If they know what they need to do to protect themselves, whether they can, out of the clear blue sky, remember mother-to-child transmission really doesn't matter. But most Chinese can actually tell you 3 modes of transmission, but it doesn't actually relate to any behavior change, right? And a lot of research, especially men who have sex with men, is they all know about condoms, they know how to put on condoms, they know all this stuff, but in fact, do they use them? That's the question. And that's very, very hard to do, and it requires very concentrated interventions. There's been a lot of work on awareness and stigma in China that's very general, sort of posters in different places, things like that. One of the things that does is sort of raise general awareness without people having any idea what they need to do to protect themselves or know if they are at any risk, right? There's a lot of posters that sort of make it sound like AIDS is scary that are out there. So there's a policy that's needed that's partly about focusing prevention messages, and that's why we've worked so closely, and I think it's starting to really have an impact in the areas where the disease is more prevalent, about focusing on most at-risk populations, because resources are always limited and you really want to actually have an impact. I think we also should recognize that these issues of stigma and discrimination are still with us in the United States, and this is a long-term process. And if the Chinese are still talking about these issues and struggling with how you really deeply address stigma in 20 years, that will be a good thing, because it's not going to be solved right away, and it's going to be something that we continue to have to work with. Hopefully the percentage of people who have access to good services goes up and prevention really works, but it's not going to be a quick fix.
We have a question right here.
Michael Yehuda, currently a fellow at the Center. I have a comment and then a question arising out of why it is very much a policy issue. And that has to do, it seemed to me, with what are the incentives and disincentives that the Center provides to local officials as far as their own career prospects are concerned. And there the emphasis is, first of all, the priority given to economic growth, and the disincentive to be a troublemaker or to report trouble. And I think that in that respect it is a policy issue. My question, though, arises out of something that Bates mentioned very briefly, and that has to do with the role of NGOs and international NGOs. My understanding is that they have played enormously positive roles in many parts of the world, but they are now coming under various restrictions in China. And I wonder if that is true and whether that has an impact on the issues that we are dealing with.
I think a number of INGOs run into challenges in China. I think it varies, and it varies by what they're doing. In general, those that are working on health and environment generally report not huge differences in the environment they're working in right now versus 5 years ago or 10 years ago. That's not necessarily true on all topics. One of the big challenges for INGOs in the last few years has been a great deal of tumult about how to go through the NGO registration process. There was an NGO law that was proposed about 4 years ago that started in the drafting stage and never went anywhere, and then that prompted a big review. A lot of NGOs have been able to register relatively easy under the Ministry of Commerce. They all need to register under the Ministry of Civil Affairs now, and that process has gotten bogged down. Whether that affects their ability to do their work seems to vary, and different groups will tell you very, very different things. What we've seen is that the Chinese government tends to like to work with NGOs when they can view them as donors, not when they view them as competitors for international funds. And they very much want to see some kind of international additionality from the collaboration, that there's something new that you're bringing us from the outside, some new knowledge, some new system, some training, something that we don't have locally. Because if an international NGO is going to have all local staff, and their question then becomes, what is it that you're offering us that we can't just do ourselves with our government organization? And it may be that one can make arguments as to what that would be, but that's where the local government partners. I think the other thing you'll see is that most international NGOs operating in China operate very much from sort of a point of view of partnership with government. We will partner with you to help you achieve X or Y end. And you don't see a model of sort of fostering local activism, which certainly in a lot of other countries, organizations like the World Wildlife Fund in India has become a completely local activist organization, and that's the same in Hong Kong. That isn't true in China. So it's a very different approach. They have a role, but it's different.
I would just add that I think we are in a period of some retrenchment and caution on the part of both international and local NGOs in China, in part a reflection of the difficulties that many seem to have in terms of becoming legal and operating legally by going through the entire registration process and finding obstacles there. Also, I think there's just a general sense of some increased scrutiny on the part of Chinese government authorities on the activities of NGOs. But I mean, this is very common. I mean, the whole history of civil society development in China has been one of expansion and then some contraction and then expansion beyond where they were. And I think we're in a period of some contraction right now. But I think that's likely to lift and be relieved, I suspect, just as it has in the past. And maybe it's because we're going into the 17th Party Congress at the end of this year. It's no doubt also a reflection of the Chinese leadership's concerns with the color revolutions of Central Asia, Eastern Asia, Eurasia, Ukraine and Georgia and etc., Kyrgyzstan, and also going into the Olympics as well. So maybe we're going to have to be in a slightly tighter period for another year or so, and then hopefully it would release again.
And if I can add that the China Environment Forum, I mean, we track, and in fact, we inventory Chinese environmental NGOs and international NGO projects in China. It's a nerdy thing I do in my free time, and see who's doing what. And one thing that I've been struck with, and I agree everything that what you both said, and particularly Bates' final comments about this kind of expansion contraction issue. But there's also, keep in mind, it's not just a top-down system in China. There's been the green groups. I mean, about at least half of them. We think there are 2,000 registered, at least as many unregistered, and who knows, or registered as something odd like a business or university group. But I don't think the NGOs necessarily are filling the political space that they have, particularly the green. I mean, they're getting more, but they have been challenging. There was a national campaign demanding more transparency in dam building, and while one NGO activist in Yunnan was not allowed to leave the country for a while, when you think of it, the fact that no one was arrested with that, And that, you know, that's a bit, for me, it's like, woohoo, success. No one was arrested. And maybe the dams will still get built. But, you know, little muscles being flexed. And, I mean, while I'm not an expert on the HIV/AIDS groups, Bates, my feeling has been that I tend to hear more stories of the HIV, the activists being harassed. But this harassment is by the local governments. I mean, nothing comes to mind about Beijing ever harassing an NGO. Would that be correct?
I think that's probably right.
And it's one locality. On the other hand, almost none of the AIDS groups have been successful in registering. That's been a big problem.
Yeah. Okay, Beverly was next. I want to stay true to my order, folks. And I think, Beverly, I think you're going to close this out.
Okay.
Make it a good question.
All right. I hope so. I think Debbie just gave me a new term to use, additionality. I think I just wanted to add that. I think the Chinese diaspora also has a role to play, which, you know, it's not as big as these international collaboration and cooperation stuff. But, I mean, I noticed that the Hong Kong has a big, you know, delegation or delegations, you know, medical delegations to China. I mean, these are not officially registered, I don't think. And LA has that. New York has that. We in Australia, I used to be my colleague. We in Washington also has, you know, and there are also, in addition, there are also many provincial associations. They have provincial affiliations, and they can help. And as you know, many Chinese come over to this country and to other countries. They get very well trained, and they use their expertise. I mean, even me, as a social linguist, I was able to promote anti-smoking campaign in China. Every time whenever you have the podium, you have a chance to speak. And we, as highly educated people, we have a podium. And so that's the additionality that I want to say.
Ooh, that's a new term. Okay, well, thank you very much. I think that was a nice closing comment there, that there's a role for a lot of folks to play. I want to thank, first and foremost, our three speakers who gave us a great overview of the cooperation HIV/AIDS. Applaud for them one more time.